My name is Dr. David Wallace. I'm with OakBend Medical Group, and today we're going to be talking about osteoporosis.
So, what is osteoporosis and what causes it?
Osteoporosis is a bone disease where the body loses too much of its bone or doesn't make enough, or both. The mesh structure inside the bone becomes too thin, or the density of the bone becomes low, and the bone becomes weak and it fractures easily. It is caused either by age-related causes, just being older. As we get older, our bone loss decreases, which is a relatively slow process. Or in women, once they are postmenopausal and their estrogen levels drop, their bone density decreases quite rapidly.
Okay, who is at risk at getting osteoporosis, and is it hereditary?
So it is hereditary. If your parents have it or someone in your family has it, you are more likely to get it than someone who doesn't have it in their family. 1 in 2 women and 1 in 4 men will develop osteoporosis at 50 years or older. And there's about 1.5 million fractures from osteoporosis every year. The risk factors are being Caucasian, Asian descent, history of cancer or chemotherapy, being thin-framed, prolonged steroid use, hyperthyroidism, poor nutrition, diabetes, physical inactivity, and just being a woman.
Okay, so how is it diagnosed, and what happens if it goes untreated?
So osteoporosis can really only be diagnosed by a test called a bone density scan, or a DEXA scan, D-E-X-A scan. It gives you a score, a bone mineral density score, that you compare to the national averages, and those numbers will determine if your bone is normal, thin, or osteoporotic. It cannot be diagnosed on an X-ray or an MRI.
Are there any symptoms that we might see, and how quickly can it progress?
So usually there's no symptoms with osteoporosis. Patients will get confused sometimes and think it's osteoarthritis, that they have joint pain or bone pain, and think it's osteoporosis, but osteoporosis does not cause any symptoms unless there is a fracture. If osteoporosis goes untreated, you're going to fracture either your hip or your back. You can develop fractures in your shoulder and your wrist as well, but we worry more about the hip and the low back. As far as progression, postmenopausal women will progress much faster once they stop having regular periods. Their bone density will drop significantly, at least 1% a year, and by the time they are 80 years old, half of their bone mass is gone. As opposed to men, about 18% of their bone mass is gone at 80 years old.
Well, can it be prevented, or is it possible to cure osteoporosis?
There's really no cure for osteoporosis. It can be prevented in some respect. You can minimize your risks such that if a patient smokes, if they're doing regular weight-bearing exercises, that can improve your bone mass. Weight training with weights, maintaining a healthy weight, and minimizing oral steroid use. But if you're a woman and it's hereditary, you're more likely to get it than a man, but anybody can get it. So there are medications you can use to either slow the process of osteoporosis, and in some cases with the injectable medicines you can even reverse it while you're on the medication. Once you stop the medication, your bone loss will resort to whatever it was previously. The long-term outlook for osteoporosis is there's quite a bit increased risk of death within the first year of having a hip fracture, and that's why we are very concerned about osteoporosis. 50% of people who have a hip fracture from osteoporosis never regain their normal function or activity level. And even those who are able to regain their activity level, most of those require long-term care. I think, what I see in my practice is that a lot of osteoporosis goes undiagnosed. Unfortunately, when they come and see me, they've already had a fracture. And so a lot of their preventative and maintenance testing as far as bone density testing is not being done. And so I think that is something that's kind of getting missed, and it's understandable with all patients having hypertension, diabetes, high cholesterol. Those things kind of are pushed to the forefront, but osteoporosis is definitely something that is getting missed, and that's something that we need to make sure that our patients are getting tested for.